A flow chart is a living document that is changeable, but is easily understood by everyone in ways that other documents in the past, maybe you weren't clearly, it wasn't clear whether everyone understood it. Flowcharting involves making a picture of a process. It's identifying the input or the beginning point of a process of work that's being done and taking the sequence down to the output of what you want to do. It's the easiest way for people to picture a process. The way we do flowcharts is we include something called swim lanes. So it identifies the person who answers the phone, the rooming staff, the nurse, the providers. So it's very clear who does what. One of the first things is to define something that needs a process. So you have a workflow and you're not really sure who does what or in what order. If you say, we need to come up with a workflow and a process for how we refill high blood pressure medicines, and that there are certain things that need to be looked at, you literally can say, well, we have a medicine that needs to be refilled. That's the beginning in the oval. The output is the medicine is refilled. And what happens between the beginning and the end? And you can literally stand there with your team, the people who take the phone calls, the unit coordinators, the rooming staff, the triage nurse, the providers, and decide what really needs to happen and break it down into a way that everyone understands how the process works. Sequencing out a process and a workflow that works within your own setting is so much more easier than you would ever have guessed. And it's extremely useful to have the folks who are going to be working in the process build the process. There is a piece of software called Visio, and it's available through IT. Not everyone will have availability to it. Clinics will have to decide who they want to have their Visio experts to be. But by far the most useful tool we had were pieces of paper and sticky notes. Because when you are deciding how to make a picture of a process, sometimes you think you go from A to C, and then you realize you left out B. So if you have sticky notes, you literally can put them up on a board and move them around until the process makes sense. Within Fairview and within CMI, there are tools and processes that have been standardized and expected to be used as is. There are also opportunities for people to come up with processes that fit within their own clinic setting, and there is some flexibility within that. Within care packages and some of the care model redesign, the expectation is to use the flowcharts that have been developed within those care packages as a gift to, not have to reinvent the wheel. Because everyone's involved with process, and that's part of CMI, anyone can begin it, anyone can own it, but everyone should be able to think through sequences. They may not understand all the jobs, if it's not something they normally do, but there's no reason someone answering the phone, a rooming staff, a nurse, or a provider, any of those folks could be involved in flowcharting and should be involved in flowcharting. CMI is bringing all that is good and all that is known in the evidence-based part of medicine and trying to standardize that across and yet maintain that relationship with patients.